Hey everyone, welcome back to my channel. Today we're going to be talking about my best pieces of advice for mamas who are having a C-section or end up having one, or you just want to prepare in case you do have one, that kind of thing. This is literally the third attempt at recording this video, so enjoy. Just to qualify myself really quick, I have had 2 C-sections and they were non-emergent, but I did have them, and so I feel like I have a leg to stand on when it comes to good advice about being in a good headspace and how to make yourself poop faster and all the good things about surgeries and C-sections. So let's get into it. My first piece of advice that I would tell anybody that's having a C-section is to stay in a good headspace. And I know that is really easier said than done, but it's really important and will completely change the way you view your C-section is if you keep yourself in a positive headspace. The way I did that was by playing music. A lot of surgical teams will allow you to play music as long as the situation is not emergent. The first C-section I had, my husband had his phone and he was playing music like by my head, and that was really nice. I played worship music and it helped me feel a little bit calm. And then the second C-section that I had, I was offered the opportunity to have music played like over the speakers in the surgical room. And so they put on like top 40 and we were listening to like Taylor Swift and stuff, and it was super fun. The one thing that I will say is that just kind of analyze how you're feeling when you go into the C-section, and if you're having like a scheduled one, just think about the kind of things that are gonna make you happy. I thought worship music was gonna make me really happy and grounded, but it turned out that I liked lighthearted music a lot better during my surgery. So just keep that in mind when you're choosing your playlist. One of the things that music did for me was just kind of ground me, because you start to feel like you're in an out-of-body experience and you don't really know how to feel. And so listening to your favorite music or your favorite genre can often just ground you and remind you that like you're in the moment, that you're okay, you're breathing, you're living, you're fine, you're safe. And that is really helpful for me, at least. The second part of this is just staying positive and staying in a positive headspace. Some of the things that I repeated to myself during the surgery was that I was safe, I was taken care of. There were people with lots of experience working on me. They've done this surgery hundreds of times. They went to school for years to do this. This is a tried and true procedure, and that tons of women have it, so I'm perfectly fine, I'm safe, and in the end, God's will be done. The second piece of advice that I have is to watch videos like this that are positive and that see C-sections in a positive light, and not videos about it being the worst thing that could have happened to them, or horror stories, or any of those. It may be tempting to watch those videos, but if you're having one or you want to prepare yourself for the possibility of having one, I definitely recommend keeping the videos that you consume about C-sections positive. The next piece of advice is sort of along keeping your head space positive, and it is talking during your surgery. There was a moment where during my first C-section, I was laying there and I was just kind of like letting my thoughts go. And I remember thinking, I could seriously freak out right now. Like laying there, knowing that they're cutting me open. My husband wasn't in the room yet. And I just vividly remember being like, OMG, I could totally freak out right now if I really wanted to. And that's not a good place to be in. And so one of the things that I did my second time around that really helped was talking during my surgery. I was talking to my husband, I was talking to anesthesia, who was standing right behind me. We were chatting, we were joking, we were keeping the conversation going, and that kind of like lets your mind go somewhere else while they're working on you, and it makes the surgery a lot easier. My next piece of advice would probably be one of the most important pieces of advice, and I think anybody that's had a C-section would say the same thing. As soon as you can after your surgery, whenever your epidural or your spinal wears off, start walking around. Just so you know what to expect, it is pretty painful to get up and walk the first time. Your abdomen is cut open, and so you need your abdomen and your core to like get up and to hold you up, and you're using all of those muscles that have basically gone into shock after your surgery. So once your spinal and your epidural wears off, you're gonna feel a lot of that pain, but the more you get up with each time that you do it, it gets less and less painful. Moving around just like loosens up your muscles and loosens up your body and gets it kind of jump started again, so we can start operating normally, because you've put your body in shock essentially after a surgery. It's kind of like freaking out and trying to heal you and reacting in all these ways. And so doing basic things like getting up and walking can help it kind of return back to normal. And in my experience, the first time that I had a C-section, getting up was extremely painful for me. The second time around, not as painful. I don't know if it was because I knew what to expect or what, but as soon as I started walking, I felt a difference. I would get up and just literally stand there. If I didn't have to use the restroom or walk and go get something, I would just stand up and just stand there and, you know, watch TV standing up, or, you know, go and put deodorant on and brush my teeth or something. But I was getting up as often as I could because I wanted my body to start feeling better. The next piece of advice that I have is just to chug fluids and eat right away. And the first C-section that I had, I actually vomited during, well actually, no, I threw up during both. But the first time that I had one, they didn't want me to eat right away just because I had thrown up during the surgery. I'm not really sure what that was about. But the second time I threw up and they were like, no, go ahead and eat, you've earned it. But chances are you've probably been laboring for a long time before your surgery actually happened, and so you're gonna be starving, you're gonna be thirsty, and I definitely encourage you to start eating and drinking as fast as you can. One, it's gonna help your milk, just because you're gonna be hydrated and stuff, but two, again, it's gonna start moving those bowels, and that is a big problem that a lot of women have right after their C-section, is that they become constipated. You're gonna be on medication for that, chances are, but eating and drinking does help everything kind of move along, and it just helps you feel better. I mean, you've earned it. You just popped out a baby, so you should definitely start eating and drinking. The next thing I want to talk about kind of goes along with this, and is as you're drinking a lot of fluids and you're eating, along with the fluids that you were on during your surgery, along with everything else that's going on in your body, you're definitely going to have some swelling. And for me, both times, basically from my knee down, I was really, really swollen, and all of the nurses reassured me that it's completely normal for about a week after your surgery. You're retaining a lot of fluids at that point, so just keep that in mind. They're probably gonna put some compression socks on you, or this machine that kind of like tries to pump the fluid out of your feet while you're in your hospital bed. But just expect that, and don't be scared of it, because it is gonna happen. So keep that in mind as you're drinking a lot of fluids. I know for like a split second it made me not want to drink a lot of fluids, because I was like, I don't want my swelling to get any worse, because it's pretty uncomfortable, but everything's fine. It's better for you to be hydrated. The next piece of advice that I have is like kind of like a TMI a little bit, but it needs to be talked about. And once you have a C-section, I can't speak on all women's bodies, but I can definitely speak on my own. I am a larger woman, and I had this like flap of skin after you have a baby, especially after my second C-section. So your stomach will kind of like hang over the incision a little bit, and it is very, very, very important that you keep that area clean and dry. And I don't know about other hospitals or other medical centers and like what their procedures are, but basically my nurses told me that like a couple hours after my surgery, I was good to take a shower. It could get wet. They didn't want me using like soap right on it, but I could like rinse it and like care for it that way. So making sure you're wiping it down with like a washcloth, or taking a shower and like rinsing it really well, and then keeping it as dry as possible. So making sure that it's not like always like, I don't know how to say this, but like flapped over, like lift it, and like even if you have to use like, I use the blow dryer on a cool setting and just would like air it out a little bit. It will start to smell if you don't take care of it, and it can get infected and all of that stuff. So take care of your incision, especially if your stomach like fully flops over it and it doesn't have like much room to breathe. You're gonna want to address that and like make sure you're taking care of it or it could get really nasty. The next piece of advice is really embarrassing for me, but I'm sharing the information because that is what I'm here to do. The second time I had a C-section, which was just 2 months ago, I forgot about the tape that was on my incision. So as soon as it starts to kind of fall off, they say go ahead and like peel them off. Those little tape things that go over your incision, you'll know if you're watching this and you've had a C-section, like you'll know what I'm talking about because it's literal tape on your stomach. But anyway, they're little pieces of tape that go over your incision. The first time around, I was really attentive to my incision because it was my first surgery, and by the second one, I had a toddler to take care of and a newborn, and I just, like, I wasn't bathing as much as I should have. Cringe, I'm sorry, but I wasn't bathing as much, and my stomach folded over even more than my first, and so it was just like, it was just not in my head to like be taking care of that area. It didn't get infected or anything like that, but I did wait way too long to peel off the tape, the surgical tape, and without any details, it was just really gross. Like, please make sure that you're attentive to your incision because it was really nasty. So this piece of advice may seem like common sense, but I feel like a lot of us need to be reminded of it. If you're unsure about any way that you're feeling during your recovery, please go to your doctor. That's what they're there for. They're paid to see you and take care of you, and not only take care of you in like literal like body terms, but they're there to reassure you about all things medical. There was a lot of stuff going on during my recovery of my second cesarean, and I started to notice that one of my legs was the swelling after the surgery was going down, but one of them wasn't. I was feeling excruciating pain in the back of my knee. It was just really, really uncomfortable, and I was thinking like, I'm just being a weenie, like I need to like get over it, but I was having trouble walking, I was having trouble sleeping, it was waking me up at night, and it was really, really miserable. Like, I'm not exaggerating, I have a pretty high pain tolerance, and this was miserable. It was like comparable to contractions, but just in my life, and it was the worst, and I held off for way too long. I waited until I absolutely could not stand it anymore. I went to the ER, and turns out I had a blood clot. So I just would encourage anybody that's feeling abnormal about your incision or the way things are going or the bleeding that you're experiencing or any pain, any swelling, or any, you know, mental health situations, like you're not feeling as happy or you're feeling like, you know, maybe you have something more than just baby blues. Any of those situations, you know, I would highly encourage you, just go straight to your doctor. Like, skip the middleman, skip the mommy groups, don't ask anybody else, just go ahead and go to your doctor, because I feel like you're not wasting your own time at that point. So that sums up my advice on having a C-section and recovering from a C-section. I just want to speak to all of the women that are about to have a baby. Please don't think of cesareans as the worst case scenario. I have failed at that point, like that kind of thing. Obviously, they're not everybody's ideal situation, but I promise you that you can do it. It's not as scary as you think it is, and with the support of your medical staff and maybe like somebody with you, a support person, you can definitely get through it. And afterwards, you'll feel like a complete badass, which is just a bonus of having C-sections. So if you have any advice for new mamas or mamas that are gonna have a planned C-section or that are just worried that their labor and delivery might end in C-section, please drop your advice in the comments below. I know that when I was having children, I would always look at comments and just see what everybody else was saying about this topic. And it made me feel a lot better that there's tons of women that have had C-sections, that this is a definite tried and true procedure. It happens all the time, and there's tons of women on the other side that will help you get through yours if you do have one. So please sound off in the comments because I love reading those as well. Thank you so much for watching this video. I hope you learned something from it, and good luck with your labor and delivery, or congratulations if you've recently had a baby. So I love you all.